everyone. I'm Dr. Mehwish here with you in another free webinar. See, this is the disadvantage when you don't eat anything for the whole day. I forgot turning on my mic, so now I guess I'm audible. Again, welcome everyone to the webinar, which is conducted by MedExam Expert team, and this is especially conducted for the students of MRCOG-1 2023 July. Thank you. So, doctors, I'm really happy that all of you are attending the webinar because these interactive sessions are full of knowledge. You can ask about the questions which you sometimes students hesitate sending a question, but in the live webinar, they can interact with the mentors easily. So let me give you a brief introduction of our team. In our previous webinar, I told you that we have a wonderful team, world best team for teaching MRCOG-1 candidates, and Dr. Muhammad Hilmi is our lead mentor. So Dr. Muhammad Hilmi is a well-known. Dr. Muhammad Hilmi is a well-known mentor, and he is teaching most of the subjects, actually all the difficult subjects he teaches for MRCOG-1, and he is also an RCOG examiner. So the accuracy and updated information he shares in the live sessions, it's so good that I can say that we can't think about having a team without Dr. Helmi. He has such a wonderful knowledge, and the dedication for his team for the course is so appreciable. So we have Dr. Desiree. She is also our senior mentor. She takes biostatistics and microbiology. I've already told you that biostatistics is one of the very difficult subject in MRCOG-1. Actually, for the doctors, the calculations, the math kind of things, these are only difficult because we are not used to these things in our daily lives. We're used to calculating the doses. We can learn a lot and a lot of names of the medicines, and sometimes we do our duties. We are like sleepless, and we're deprived of sleep, and we don't eat anything, but we don't forget the names of the medicine. But biostatistics, why I feel this is a difficult subject for the students, because we are not used to using the formulas and the calculations. So this subject is made by Dr. Desiree very, very easy. Okay. 1 minute, please. Then we have Dr. Ramya. The main subject she teaches is the anatomy and the clinical management. And again, anatomy is a difficult subject, anatomy of pelvis and the perineum. It's very important regarding MRCOG-1. And Dr. Ramya makes this subject very easy for the students. They learn the anatomy just like they're learning about a story. And all the difficult questions from the pelvis and the perineum, they are very easy for the students after taking the live session by Dr. Ramya. I'm the moderator of the MRCOG-1 group. In the study groups, I daily conduct a session. We have selected a time, like it's 8 p.m. Pakistan time, and it's 3 p.m. GMT, and we take a very interactive and a very knowledge section in the MRCOG-1 study group. And I also teach biochemistry and genetics. So this is the brief introduction of our MRCOG-1 team. Okay. So I've told you our team was sharing the links of all the webinars. We started a free webinar series. It was started from 27 January, and today, you know, it's 14th February. And in these days, we have conducted 5 to 6 webinars. It was a series of the free webinars for all the students who are taking exam in 2023. This is for the guidance. This is for educating you. Walaikum Assalam, Dr. Farheen. So it's for your education, it's for your guidance. You can ask about the MRCOG-1 examination, the pattern, the booking, everything is covered in this webinar series. And if you have missed any of these, you can take the link from MRCOG-1 team of MedExam experts so that you don't miss any of these. So the most important one, which was conducted by Dr. Desiree, it was about the updates of CTG guidelines. We were following CTG guidelines, and I've told you, if you are deprived of sleep, if you are not eating anything, but you can't forget the CTG guidelines because you are so used to following the guidelines that you can't even forget in a bad state of your health, or you can say that you can't ever miss following the guidelines. So what happens, RCOG keep on updating things, and they gave an update for CTG guidelines, and Dr. Desiree summarized everything in a very full of knowledge webinar. Dr. Ramya also conducted a webinar on the cervical incompetency. I will today, I have collected a handful of questions which are very important, and I will tell you how to solve them. And we will also discuss the eligibility and expression of interest in the today's session. So I am again telling you that if you have missed any of these webinars from this series, these are 5 to 6, and you can take the links, you can take the recordings from MedExam expert team. So a lot of students were attending the previous webinar in which I've told you that expression of interest and eligibility are two different things. And today we have some other candidates. They are attending the webinar. And we also discussed that if September exam is cancelled, for this year, RCOG has officially announced that they are not taking September exams this year. So how you will proceed with your preparation? Is the time enough for taking the July exam? How much preparation is required? What are the books you are going to follow? We discussed everything in the webinar, which we conducted 2 days back. So today's agenda, today's aim of conducting this meeting is especially for discussing the eligibility problems students are facing, and the thing expression of interest. What is the difference between these two? Will you receive an email after sending eligibility and expression of interest or not? And how it looks like on RCOG official website. So I'm sure the first thing which you all have done is to get a college number and making an account. So please tell me in the chat box, you can turn on the mic also. Have you got the college number already from RCOG? Or else you can say if you have made the account on RCOG website or not. Please. Dr. Ufak has done this work. Okay, good. A lot of doctors are already done this work. Dr. Ayman and a doctor from this phone. Doctor, please, you have to write your name so I can call you by your name. Okay, many of the students have already done making the account. Okay, Dr. Tehreem. And they have got the college number. So this was the first step. This was the first step for taking MRCOG-1 or taking any exam from RCOG. You have to make an account and you have to get the college number. This college number will be with you until last step of your MRCOG, that's part 3. So the students who have not got the college number yet, what you will do, you will just open RCOG website. You will just write Google, you will just Google MRCOG-1, and then you will open the website, and then what you will do, you will make an account, and then you will get a college number, and then you will keep 2 things in mind, that the email address which you have sent to RCOG for the first time, You should know about the password of that email, and you should keep that email with you for the rest of the steps of MRCOG. And the second thing, this college number is also very important. After making an account, every time you log in into the website, you will get this college number in front of you. So these two things are very important to consider. So this is the calendar. These are the deadlines. These are the important dates which are given by RCOG. So please tell me, are you already aware of the exam date, this 4 July 2023? Okay. Dr. Harim has a concern. She is saying that she emailed eligibility form and degree. And I guess she's talking about the PMC number, okay, to the address which RCOG has given on the website. And she has not received any reply email. Dr. Harim, I want you to tell me that you got the response email right after sending the eligibility or not, like an automatic response. Please write in the chat box. Dr. Harim, there is a number given. Fatma has shared a number, which is like a customer service number for the students. It is 24/7 available, and you can discuss it further on this number if you are not with us. Okay, okay, Dr. Harim is with us, and she's saying you have not received. Okay, you have to do two things now. You can check the spam email section, or like the one in which your unread emails are present. And then if you have not got this automated response at all, you have to send it again, because there might be some error in the email address, or some connection error due to which your eligibility is not yet submitted, because they always send an automatic response after sending the email. Yes, we are going to talk about expression of interest, and I will tell you everything about it. Someone from Galaxy Phone, I have filled eligibility form previously, but it didn't appear in exam. Okay, if you have got the confirmation, it's not about sending, it's about the confirmation. If you have got this email saying you are eligible to take MRCOG-1 examination, then you don't have to submit it again anytime you are taking the exam. If you have failed it, even then you don't have to submit it again, because eligibility is like a confirmation from college that you can take a MRCOG exam. So you don't have to send it again and again. Okay, Dr. Harim, team is sending you this email ID on which you have to send the eligibility application. Dr. Mehwish is asking, can we change this email address afterwards? An option? Okay, I'm sure there will be an option. Like it's not a restriction that you can't use any other email address. So definitely you have to inform the college about it, that you are going to change the email address from now. Okay. Dr. Tahim has got the confirmation of eligibility. That's great. Dr. Afreen, you have to write your question again, because it's unclear that which exam you have already taken. So we were talking about the deadlines and the dates. So you can see that eligibility deadline is Monday, 6 March. Before that, you can send the eligibility application. Before Thursday, 16 March, you can send the expression of interest. Then on 27th April, you can book the exam, and the window will be closed on Friday, 9 June. So these are all the dates. These are very important. You have to save them with you. So we will discuss about the eligibility now. Okay, you have taken MRCEM Part A, but okay. Actually, MRCOG is quite different exam, and for taking it, you have to send the eligibility application to RCOG. Okay, these exams are not similar. Yes, you can take MRCOG 1 now. So who amongst the candidates will just turn on the mic and read this text? From where I have got this picture? Who can tell me? From where I have got this picture? From where I am delivering this information to you? What do you think? Okay, Dr. Raymond, we're going to discuss it. Firstly, answer my question. This picture in front of you, from where I've got this information? What do you think? How to apply, how to book? Yes, RCOG website. Actually, RCOG website is very user friendly. Yes, good. Yes, Dr. Dido is saying MRCOG website, good. RCOG website, Royal College for Obs Gynae. It's giving you all the information on the website. It's very user friendly. You can Google it and you can get all the information. And if you are not done making an account, you can see all this information without making an account. So just anytime you are having a difficulty in anything, you just open the website and check if there is information present or not. So I will read it for you. To take part 1 exam, you must be eligible. And what is the meaning of the eligible? And they're saying for new first-time candidates, this means submitting a complete eligibility application and having it approved also. Okay, and they are clarifying that reseat candidates are already eligible and do not need to complete another eligibility application. So this is a very clear information that reseat candidates will not send an application again. And they're also saying that you have to be eligible for taking part 1 examination. Okay, this is the form which is available on RCOG website. Anyone can download it and anyone can fill it and send it back to the RCOG. This is the form, and while filling in this form, you must fill in all the sections given. And another thing which you have to send with this form is your degree, your medical degree. Now, another problem which students are facing, they are saying it's around 4 weeks or it's more than 4 weeks that RCOG has not replied me about the eligibility. So I'm not having the confirmed status of the eligibility. So can I go for the exam? So they have clearly said that they want you to allow up to 4 weeks after the published closing date for your part 1 eligibility application to be processed. So for this July exam, what is the date? But this is the deadline, 6 March 2023. They are saying after 6 March, they can take 4 weeks further. Okay, so they can take 4 weeks after the eligibility deadline, and before that time you should only be sure that you have sent the application and the form on the right email address and they have received your application. Other than that, you don't have to worry. If you are eligible, they will send you the confirmation in all cases. If approved, you will be then eligible to book a place on the part 1 MRCOG examination. This is the next step. After getting the confirmation, you can book the exam, and it is not possible for the RCOG to accept late applications. So when I'm saying that you should keep the dates with you, you should be aware of the deadlines, and you should never miss the calendar, which is updated by the RCOG. You should keep this thing in mind. Okay, Dr. Mehwish team will guide you about it. And it's actually just you have to. Okay, Dr. Mediha, I will upload the recording of this session. Of course, we will upload it on the YouTube channel. Team will guide you about it. You just have to send an email. Okay, Dr. Mehwish, it's not an issue. So now comes the expression of interest. Thank you. So what is the expression of interest? I've told you that firstly you will get the college number. So you will enter this college number and then you will enter the email address from which you have got this college number. I've told you that email address would be same for everything you do after making an account. Then you will write your name, your first name and your family name, and then you will just click send. And this is all. This is the expression of interest. So I keep on telling students that eligibility is something you receive from the college, that you are eligible to take the exam, and expression of interest form is just for informing the college that you are going to take MRCOG 1 exam in 2023 July. So every time you are taking the exam, you have to send this expression of interest. Right now, this is the question from my side to you. If I was a candidate in the January, I booked the exam and then I couldn't take it by any cause, I was not able to sit in the exam. So now, will I send the expression of interest again to RCOG? What do you think? Okay, Dr. Ashu, we are going to discuss it also. Yes, send it again. Every time you are going to take the exam, college doesn't know about it. They have given you the eligibility already, but now you have to tell them that in 2023 July, I'm going to take the exam. Then if you miss that exam, doesn't count. If you are taking the exam in coming January, then you will send the expression of interest again. And now we will come to this question. Yes, Dr. Sidra is saying you have to send it again. So I think this confusion is quite clear. You have to excuse me for just 1 minute, doctors. Okay, very sorry for this interruption. Now, Dr. Aisha is asking if they will take 4 weeks after the deadline they have given. And sometimes they send the eligibility before the deadline. This is just, it's like they're informing that they can take this time so that students don't get worried about delaying the confirmation of the eligibility. So then she is worried that if sending the expression of interest, she can also miss the deadline. So students, you can send the eligibility and expression of interest all together at once. Okay. Actually, I've told you these two things are not similar. Sending the expression of interest only about you are going to take the exam, but getting eligibility, the confirmation is another thing. Now, this is another important question Dr. Femi has raised, that if you will get an automatic email kind of response from RCOG for expression of interest or not. So no, you will not get an automatic response from RCOG for expression of interest, but for eligibility form, yes, you will get one. Dr. Afreen is asking, I'm not practicing, so how can I give my college ID for application? I'm not sure what you are what is the meaning of college ID exactly. This is just if you have got a degree, you have got a practice number. In every country there is a different registration number. For Pakistan, we get the number from PMDC, and this is the medical registration number, and you have to enter this only. So if you got the degree and you have got the medical number, registration number, then you can send it. Thank you, doctor, for appreciating these informative lectures. Yes, thank you so much. These are for new candidates who don't know anything about the course who don't know anything about the exam. So this talk, this interactive live session is very important for them to take. So now you have uh, got the detail about sending expression of interest and sending this eligibility. See, this is the eligibility form. It is quite different from the expression of interest form, and they will not respond you in the form of an email after sending the expression of interest, but they will send you a confirmation email after sending the eligibility. So once you have confirmed the eligibility, once you have got the confirmation from RCOG, then you can book the exam into Person View Center. And I've told you, you have to see this calendar again, that when they will open the booking, every time they open the booking window, MedExam expert team, everyone from MedExam expert team, the mentors, the technical team, the admin staff, everyone, they provide so much help to the students, because we do understand that it is sometimes difficult for some students to book the exam. So they provide 24/7 help and assistance to students before booking the exam. So it's not a problem for anyone who wants to take the exam. If it's about preparation, and there is a plan with you by med exam expert. If it's about booking, the eligibility, the deadlines, anything MRCOG regarding MRCOG-1, med exam expert is providing 24/7 help. So I'm giving you now this timeline. Okay, you are going to take the exam, you are done with the eligibility, this expression of interesting. These are things which are going side by side. But what about the preparation? So the regular July group, which is right now preparing MRCOG-1 exam with us, they are done with the recorded sessions in December and January. From the February uh, to 2nd of the February, we started live sessions. These are subject-wise live session, and these are the best source of preparation for all the subjects. And in the February and March, and further till May, we will complete all the subjects and the past papers. And the main thing on which we are working on is the concept building of the students. Then there will be a revision month, and there is another course, progressive course, which is actually designed for revising all the important points. And then another very powerful, very full of information, 5 days workshop right before the exam. And on the 4th July, you can take the exam with a lot of positivity and information. So this is all about sending the expression of interest and eligibility. If you have any questions regarding this, you can ask me in the chat box, or else you can just put on the mic and you can ask your questions, so that we can proceed to the next part of our today's webinar, which is how to solve SBAs in MRCOG 1. So Dr. Mehak got the connection lost. Okay, Dr. Mehak, you can replay the session anytime after you are provided with the recording. Dr. Raymond is asking how much time is required for MRCOG. Okay, doctor, if it's for me, I can take like more than a year. If it's for you and you are a fast learner and you are a quick learner, then you can take the exam in 3 months. But there is an estimate, an average estimate of time for all the students, it's 4 months. In 3 to 4 months, if you are dedicated and you have just decided that you will pass the exam in the first attempt, you can prepare for this exam. And of course, you need some help. And yes, on average, 4 months. You need some help. Why you need some help? Because we unluckily we have got books which are very important for taking a MRCOG-1 examination, but they are not updated. So in all the Royal College exams, you have to be aware of all the updated information, all the updated guidelines. In MRCOG-1, I would say that they do not ask about guidelines much. It's actually the syllabus for part 2. But what happens in the basics, in the management of the patients, and very simple questions, they ask some questions from the guidelines. So like I've told you, Dr. Desiree conducted a session for updated CTG guidelines, which is equally important for all the parts of MRCOG Part 1, 2, and 3. So you have to take help from a mentor who knows when there is updated guideline, what are the mistakes in the books, so that they can guide you about it. Dr. Femi, there must be some mistake, and you have to discuss it with the team of med exam expert. There must be some mistake because they definitely send an automated response after sending the eligibility email. Okay, let's start for solving these questions. Dr. Yemen, right now we are in this session, and then we will inform you about coming sessions also. If you are talking about the live sessions of the course, we have shared the schedule already. If you are talking about the free webinars which are available on the YouTube for all of the candidates, for the public, then I will inform you about the next webinar date soon. The next live session is on 27th February. It's genetics, and I will conduct this session for only the candidates of the course. Dr. Kalwanti, you will not get an email after sending expression of interest, but at the same time, there will be a notification on your screen that you have sent the expression of interest successfully. This kind of notification only, nothing else. So students are writing answers in the chat box for this question. So doctors, what we have to keep in mind now, you are looking at a question, it's having a stem, it's having 5 options. These are SBAs, single best answer, okay? Single best answer. So in the question, you will get a lot of information which will lead you towards the correct answer. And while solving the questions in the exam, you have to keep this thing in mind that what you have to pick from the question. Like any question in this world, when an examiner is designing the question, what he does, he provides you an information, a background stem. That background stem is sometime unrelated to the main question. Then there is the main keyword, which is leading you towards the answer. So the main leading words in this question, actually it's a simple one because it's not a detailed one, and you have to do not have to go into detail, and you can get the answer quite quickly. So what they're asking, competitive oxytocin receptor antagonist. Okay, so first thing they have told you, this is a tocolytic drug. Now in the options you can find many tocolytic drugs, but then they are giving you a keyword, competitive oxytocin receptor antagonist. So if you find nifedipine, a common tocolytic drug, and if you find terbutaline, a common tocolytic drug, then you can't say that this is a correct answer because this is the keyword, competitive oxytocin receptor antagonist, and it's the answer for this is only one. So let's see what is the answer. So students have given correct answers mostly. Atosaban is the oxytocin receptor antagonist. Okay. Dr. Inaya is asking, other than Passamar COG and Oxford Notes, SBAs, what other books should we use? Oxford Notes and the Essential Revision Guide. These 2 books are theory books. Again, I've told you Oxford Revision Notes has a lot of mistakes. Why I'm saying mistakes? They have not given you a faulty book at the time of the publishing, that's 2011. But now a lot of information is updated. A lot of new researches are coming. And reading to that, going to that context, we should know that previous guidelines and old guidelines are not a part of exam at the moment. So be very careful if you are reading Oxford Revision Notes as a main theory book, okay? Now, we have learned from this question, we have got the answer. Now what you have to do, you have to read the detail. You have to read the detail of this answer. Why you have to read the detail? Because your brain is not capable of retaining this information for a long time unless you go into the detail, okay? This is the psychology. This is something you have learned from the childhood, that if you want to retain the information, you have to go into the details. So learning about the answer is a good thing. But if you learn about the explanation, if you learn about the topic well, this is what you say a good preparation plan. So itosaban is an oligopeptide. Sometimes they do talk about the nature, the biochemical nature of a drug. So they can ask, itosaban is oligopeptide on what kind of peptide. Itosaban is an inhibitor of the hormones oxytocin and vasopressin. It is used intravenously to halt premature labor. So halt premature labor is another word for tocolytic drug. Okay. Dr. Aman is also saying that she needs guidance about the books. Okay, Dr. Aman, team is sending you a message about the books. Dr. Inaya is asking, if not Oxford revision notes, then which other theory book can we use? Sadly, Dr. Inaya, we don't have much choice. We have Oxford revision notes, we have Essential Revision Guide, which are two books which are provided by RCOG. But these are not updated. I'm not saying that you have to leave this book. I'm just saying you have to take guidance and you have to know where the book is old, where the information is old. So for the updated materials, it is very easy for our course students. They just follow the material given, they just follow the sessions, and they're not worried about the old information and new information. Even the MCQs book, SBS book, which are in the market, they are not updated. And like we have got some clear and new guidelines for CTG, and you will see that in all the past papers books and in all the SPS books, they are following the old guidelines, and you will not get the updated information anywhere. So you have to follow the RCOG website or the mentors who have got this information for you prepared in the form of sessions. Okay. Yes, keep on answering this question. Dr. Fatma Hayat has a point. 1 to 2 months, so she's in favor of option A. Dr. Madhubala is saying 3 months. Okay, good. Let's see. So in the previous question, actually, doctors, are you aware that we conduct a live session on our Facebook guide group every Wednesday, actually alternate Wednesdays, not every Wednesday. And I give tips and guidelines to solve the SPS also. In this question, we learned that there will be a keyword you have to find. You are not focusing over this word tocolytic drug. You are focusing over this word oxytocin receptor antagonist. Because if you focus on this word tocolytic drug, there are three choices which are falling into this category. But if you learn about the keyword, you will find a correct answer. So in there is another tip for solving the question, that if you are thinking about one thing, this is posterior fontanelle, what is the next word coming into your mind? In my mind, I am thinking that what can be the age of infant for the closure of anterior fontanelle, because anterior fontanelle is also present in the infant. So why don't I get the information about anterior fontanelle also? Because is a possibility, it is a possibility that they can ask about anterior fontanelle also. What do you think? Yes, good.
18 months, ma'am.
Yes.
Last option, E option. For interior fontanelle.
Yes. For anterior fontanelle, this will be E. Okay, good. So for posterior fontanelle, it is 3 months. For anterior, it is 10 months. And why we are doing both of them? Because we are preparing for the exam. We are not only preparing for this question only. We are not preparing for this one particular question only. We are preparing for the exam. And if one thing is important regarding MRCOG, there are higher chances that they can ask another similar question in the exam. Okay, so what I do, I take help from such tables. Okay, I take help from such tables. These are very best tables. for developing a visual memory. These are very best tables for giving me a comparison. If I'm looking at this, there are less chances that I will forget about the 24-month and 3-month, and there are less chances of confusion also. So antegrade is 24 months, posterior is 3 months. There are two other kinds of fontanelle is anterolateral and posterolateral, and these are 6 to 24 months. Same for both. Okay, you can take the screenshot for this table also, as this is very important. Dr. Tehreem is asking, my question is that it is necessary to have English proficiency exam done before registration of MRCOG-1. Okay, English exam is required when you are going to work in the UK or anywhere the exam is a requirement. So for the PLAB, when you have to take IELTS or OET before taking PLAB, that means because that's a registration exam. So MRCOG is quite different than PLAB. It is a specialty exam, okay? It is a specialty exam. Okay, please excuse me for a minute. Okay, let me check the chat box first. A lot of answers, they seem to be correct to me. Let's go towards the correct answer now. So the most likely karyotype for a patient with complete mole is 46XX. Very good. Dr. Nazish has joined and she's asking if September attempt available or not. Dr. Nazish, we were talking about this point in detail. September exam is announced that they have cancelled it already and they're not taking a September exam anymore in this 2023 year. Okay, students, I have given you a life-saving tip for the MRCOG-1 preparation, and I've told you if you are solving a thing like complete mole, then what is the next thing which is coming into your mind? In my mind, I'm thinking about partial mole at this time. So if I've learned that most likely karyotype for complete mole is 46XX, I should know about the partial as well, because complete and partial both are moles. Okay, so again, Dr. Nazish, you can play the recording, and Fatma has already explained no September exam this year, and we have done a webinar on this specific announcement from MRCOG, and Fatma, please share the link of that webinar with Dr. Nazish. Okay, good. Dr. Sidra, you are going one step ahead, and you have given me the karyotypes for partial mole as well. So most common, most likely one is 6XXY, okay, for the partial mole, and most common is the diploid 46XX, okay. Here comes the next question. Which one of the following congenital infections is most characteristically associated with fetal hydrops? Again, you have to apply the tip. I have told you that you will find the keyword in the question statement, which will lead you towards the answer. So if you are focusing on the congenital infections only, you will see that from the options, many organisms can cause congenital infections, but they are talking about something which is specific, and that's fetal hydrops. And for these fetal hydrops, there must be only one best option which you will mark. Okay, again, I've got a lot of answers. Let's see. Okay, good. B, parvovirus B19. So you should be thinking that what can be fetal hydrops and how it looks like, and how would you know about the fetal hydrops. So this is how you get the information about fetal hydrops. Hydrops fetalis is another terminology we can use for it. On the ultrasound, you can get the scalp edema, you can get the ascites in the fetus, and then you can get the pleural effusion. So a baby full of water is fetal hydrops. There are other causes for fetal hydrops also, but the most common one is the B19. But if there is RH incompatibility, there can be fetal hydrops, aneuploidy, fetal alcohol syndrome, Bart's HP or alpha thalassemia major, or cardiovascular disease, which are also congenital. Then you can think about the fetal hydrops complication as well. And what do you think? Fetal hydrops is also associated with something which is very common, another fetal complication. What is that? What is the
What, ma'am?
complication? What is the complication? Another complication related to this B19 fetal hydrops. Okay, rhesus incompatibility is the
Microcephaly?
etiology for the fetal hydrops. Actually, I'm talking about this B19 only. So what I'm saying is that with the fetal hydrops, there will be fetal anemia also in the B19 infection. Okay. So fetal anemia can be treated. You can transfuse the blood intrauterine and you can save the fetus. What is the most common site for tubal ectopic gestation?
Ampulla
Again,
A.
we are okay. Let's see. Again, we are finding the
Option A.
keyword tubal ectopic gestation. So they have given the all parts of the tube, and students are saying ampulla. This is the correct answer. Very good. Now we are going into the detail. I want to revise. I already know, you all know about the parts of the tube, but giving a revision to these important and actually the easy questions is also important. So this is the intramural portion of the tube. Then there is isthmus, then there is ampulla and the fertilization. And sorry, the fimbrial portion, the infundibulum. The ovum is catched by the tube here, then it is going towards the ampulla, and there are high chances that instead of implantation on the endometrium, after getting into the endometrial cavity, the implantation at an abnormal place in the ampulla occurs, and this is the ectopic gestation. Another important question, mechanism of action question, mode of action question, very, very important regarding MRCOG-1 from the pharmacology. They can ask like 4 to 5 mechanism of action questions in the exam. And in the past paper file, you have seen like a lot of drugs, they're asking for nothing but the mechanism of actions. These are very important ones. So mifepristone is a drug used in medical termination of the pregnancy. This is the first line of the question, and it's not leading you towards the answer. So what we will do, what is the mifepristone mode of action? Here we will find the exact main question. So if I know about the mechanism of action, but I'm the person who is not going into the details of the answer, so I can make a mistake. I can mistakenly pick this option D. Okay, I can mistakenly pick this option D because these two are similar, agonist, antagonist. And if I'm not the person who is like working hard for the exam, so what I will do this mistake of picking the wrong choice. similar words. So antagonist, progesterone antagonist. Now we will do one thing. Why mifepristone is antagonist? And if it's antagonist, what is the use of this drug in a human being? When you will go into the detail, okay? When you will go into the detail, you are less likely to forget about the answer. So it binds to progesterone receptor to block action of the progesterone. Okay. Why we want to block the progesterone action? It increases the uterine contractility in the pregnancy. We want progesterone to be active in the pregnancy. We do not want uterine contractility. So it can be something which is related to labor. Okay. This drug is related to labor, not the pregnancy. So decidua and trophoblast separate, cervix softens and dilate, facilitating abortion. Okay. So this drug is leading to termination of the pregnancy. For a normal pregnancy, anti-progesterone drug is like not necessary. So always relate the information with the cause. Always relate the mode of action with the cause, with the use. So you can never forget about the answer. Another one, in the fetal circulation, which structure bypasses the liver, carrying oxygenated blood directly into the inferior vena cava. So you have two structures from the fetal circulation. One is liver, other is inferior vena cava. And there is something which is the answer of this question, which is not letting the blood go towards the liver, bypassing the liver. So which thing is bypassing the liver here? I am having a lot of correct answers. Wow, good. See, on the Valentine's Day, med exam is making you study and you're enjoying it. So it's the ductus venosus. Yes, it's the correct answer. We will read the detail of the ductus venosus now. Ductus venosus is a shunt. Firstly, they're saying it's a shunt because it's used to bypass the blood, bypass the structure which is liver. That allows oxygenated blood in the umbilical vein to bypass the liver, and is essential for normal fetal circulation. Blood becomes oxygenated in the placenta and travels to the right atrium via umbilical veins, not the arteries, but the veins, through the ductus venosus, then to the inferior vena cava. Okay, this is like we have summarized a lot of important information in the answer of one question. It's giving you an information that umbilical vein is carrying oxygenated blood, not the artery. It's giving you information that placenta is giving you oxygenated blood in the fetus, and it's giving you information that ductus venosus is a shunt and it is bypassing the liver. So always go into the detail of the answer for like developing a very strong memory. And again, there is another tip that you have to take help from the images. Okay, you have to take help from the images, develop a strong memory. See, this is the umbilical vein. It's taking the blood, the red blood. Then there is a liver, and ideally the blood should go into this one. But there is ductus venosus, which is bypassing the liver and taking all the blood to the vena cava. So this is all I have given you, the information for eligibility and expression of interest. I have given you some very important questions. I have given you some tips to follow for solving the questions. I have told you that you can prepare and take the exam in July. I have told you why there is a course required, why there is a help from the mentors required. And we have discussed a very important thing that, thank you, Dr. Madhubala. We have discussed a very important thing that there is always a keyword in the question which you have to pick for getting the correct answer. And you have to take help from the images, and you have to explain your answer. You have to read the topic in the detail. These are all the very important tips which you can apply and you can prepare for the exam. Take all the webinars from the webinar series by Med Exam Expert. Team will share the links with you. I will also share the links in the guide groups. So doctors, thank you so much for appreciating. A doctor from iPhone is asking, they have never read anything before, and now if they can start preparation. Okay, why not? If med exam is with you in the preparation, I can assure you about your success. Why I'm so sure that our students will definitely pass the exam. Why I am so sure? What do you think? I never say you cannot pass the exam. I always am very hopeful. What do you think? What can be the reason? A person is like so much sure about your success. Who can answer this question? Because of daily practice? Okay, good. Yes, consistency, you can say. Consistency from mentors and students both. Dr. Anam is like giving me all the credit. She's saying, I am putting the same effort with the students. Okay, believe in yourself. Good. I'm getting like very motivated and good answer, very positive ones. Thank you, students, for appreciating me. But actually, I'm so sure because this is a post graduation exam, doctors, and in the post graduation exam, we are not dealing with the kids. I'm not taking any credit for your success. In the post graduation exams, we are already like parents, we are already dealing with a lot of patients. We are already consultants in our hospitals. Actually, some of us are running the departments and the hospitals. So we are not supposed to take unwise and bad decisions for ourselves. Okay, so this is why I'm so sure that students who are appearing in MRCOG-1 examination, they're already specialists. They have already like achieved a lot of things in the life. So now they're not supposed to ignore the study, and we don't have to like force them for the study. You are already a responsible doctor and a responsible person. So I'm very much sure that a responsible person who is not forgetting that he is going to take another prestigious degree, he is going to take MRCOG in the life, and I'm very much sure about your success for this particular reason. So thank you so much for attending the webinar. Thank you so much for studying with us. And the next thing after this very important cause, I've told you, next thing, yes, the course is very much sufficient for passing the MRCOG-1 exam. All the course students, they are not worried that they are getting old and unnecessary information. We have summarized everything important in such a form that students are very much enjoying the sessions. Okay.
Thank you so much,
All
Dr.
right.
Mehwish, for this detailed explanation. And I'm sure all the confusion and all the queries of the students are cleared now. So I'm here to give you a quick tour for MRCOG-1 course. As Dr. Mehwish has already explained to you about our team of mentors, so these are the mentors that are going to guide you throughout your course journey. Friends, this is the best time that you can start your preparations for MRCOG-1 course. Why? Because you know MRCOG-1 is not an easy exam, and you need proper guidance and focused preparation and lots of practice to excel this exam. So we have made a special program for all the students out there. So whether you are married or you have hospital duties, whatever you are going to manage your preparation. Okay. So in a regular course, what we are offering is that we have divided the course in three phases, okay? The first one phase is the pre-course phase, where we are going to give you the recorded sessions, okay? You're going to watch the recorded sessions, we are going to provide you the PDF material, and we are going to add you in a study room where you are going to interact with the mentors directly, okay? And after watching these lectures and after going through the PDF, you are going to solve the mini mock, okay? And in the mini mocks, we are going to give you separate questions for each module. So you can do all the practice. Secondly, we are also giving the books and the important files so you don't have to go for any other resource. Okay. Our course is the complete package. We are giving you all the material that you require for the preparation. Next is the live session phase. And in this phase, or all the team of expert mentors are going to directly interact with all the students out there. We are going to conduct Zoom sessions in which every mentor is going to conduct a session for all the modules and all the subjects that are necessary for MRCOG-1 preparation. Also, we are going to give you the recording of the sessions if in case you have missed the session, we're going to give the recording. Also, we are going to give the PDF so that when you are revising your concepts before the papers, you don't need to go through the live sessions again. You're going to just look at the PDF, you just have to revise the notes and then you're ready to go for the exam. Next is we are also giving you topic tests, we are giving you flashcards, we are giving you biostatistic workshop. Along with them, we are giving you mock exam that will contain questions from each and every subject. Okay, and these exams will be like a real exam that you're going to perform before the exams. And a third phase is the revision phase. So after going through all the live sessions, after going through all the recorded material, we are going to give you a proper schedule for your revision, okay? In that revision, we're going to do discussions on all the important exam-like questions in the group, okay? And we're also giving you the files for that. Lastly, we're going to give you a booster mock exam that will be exactly like your real exam. So if you are going to follow this course, and I am dead sure that you are going to excel your exam. You don't need to go for second attempt or third attempt. In one go, you are going to clear your exams properly. You can have a look on our schedule. This is our live session schedule, where we have divided each subject with our expert mentor, and we have managed one session per week so that students will not be burdenized and they are going to, excel at that subject. So we have done with 2 live sessions, but those recordings will be available for our course students. So if you will join now, we are going to give you the recording of our previous sessions that have been conducted. So we have done with physiology and endocrinology, and we are going to give you recording of that sessions. And rest of the sessions, we are going to conduct live sessions. So these are the reviews of our beloved students. You can have look on all our reviews on our Facebook page, in our guide groups. We have posted all the reviews. So for other students out there who don't want to join any course, we are also giving free course library. So you can, download our application and you can practice all the mock exams on our application. If you need any help or any guidance in that, our team is going to help you. So for the webinar students or all these participants who have joined us today, we are going to give you 60% off for 72 hours. So please hurry up. Our team is going to guide you how are you going to avail the discount. Just drop in a message to our team members. Thank you so much for your attention. I hope everything is clear to you. If you have any question or team member Fatma has mentioned her WhatsApp line, please contact her and get the guidance that you need. Thank you so much, Dr. Mehwish. I'm done here. So that's all for today. Students, I guess everything is clear to you. Take care of yourselves.